Hello, welcome to the news cabin. It is Friday, April 17th. I'm going to give you a few headlines here. Take a look at the worldometer's number, just give you an update like I do. A few little housekeeping things. This is probably going to be one of my last videos. My goal was to get to 1,000 views and improve my video editing skills and try this thing out. Give some people some thoughts about what I think about what's going on. This has been a crazy time, and I think I've been able to provide some insight and just compile some news headlines and tell you what I think. I definitely think that our response to this coronavirus is worse than the actual virus itself. I think that that will showcase itself as we analyze what happened, in the a month of March and April of 2020, because I think that we're going to get back to normal life here in May. I think that there's no way that continuing this doesn't hurt us more than the amount of deaths that are caused by COVID-19. It seems to me that we didn't do much in terms of others still were at the peak and still now, which is the peak. In the United States, you're looking at, almost 1,000 deaths a day. So it's not like our complete lockdown of the economy that hurt so many people in so many ways was effective, in my opinion. What would have been effective would be to concentrate our efforts on the people who are most vulnerable. Those are the people who are at the highest risk of death, and they should have taken all of our energy, and there should have been a complete separation in the way that society functions between those who are at higher risk and those who are not. Instead, we decided to really not look at the evidence and pretend as if there was not a great, gigantic divide between those who are in poor health and those who are in good health in terms of how this thing affects people and the risk of death. So that's really my, from what I've seen, that's my overarching thoughts on the pandemic and our response to it. All right, guys, gonna take a look at the worldometer's numbers right now. All right, 2,197 cases, 147,000 deaths worldwide. So this, on April 14th, which was a couple days ago, it jumped up. I think that they're doing reporting, and then they're updating the number. But that's where we're at. And I wanted to take a look at actually these right here, because they change up how, right here, these they put the comparison of Europe and United States, cumulative death numbers in Europe versus US since the 100-day, since 100 deaths, right? So it's like, this is, middle of May. And for Europe, it's the beginning of May. So we're on the same trajectory. This shows again since 10,000 cases. So again, same trajectory for Europe and the United States. And then just go down here. So as of today, 34,000 deaths in the US, 19,000 deaths in Spain, 22,000 deaths in Italy. And look at how Germany's been able to deal with this a lot better. Whereas Sweden, with only 1,400 deaths. It definitely seems like herd immunity, which is a strategy which allows you to function. Everyone knows what they're doing. They have right now. Sweden is not wondering when they're going to open up their country. They're together, understanding what their strategy is, and it's just a completely different situation than United States or France or many other countries who had a strategy of telling everyone to go home because that was the least risk, by which doing that creates so many other problems. And we're going to talk about one of them right now. Domestic abuse is up. A new COVID-19 crisis. Domestic abuse rises worldwide. Movement restrictions aimed to stop the spread of the coronavirus may be making violence in homes more frequent, more severe, and more dangerous. That's one thing about something like this, is it exposes people. If you're mean, it makes you meaner. If you're nice, it makes you nicer. If you help your community, it's going to incite you to help your community more. If you do this, do terrible things to women, then it's going to put you in a position where, well, you're add another public health crisis to the toll of the new coronavirus. Mounting data suggests that domestic abuse is acting like an opportunistic infection, flourishing in the conditions created by the pandemic. There was every reason to believe that the restrictions imposed to keep the virus from spreading would have such an effect, said Marianne Hester, a Bristol University sociologist who studies abusive relationships. Domestic violence goes up whenever families spend more time together, such as the Christmas and summer vacations, she said. The United Nations called on Sunday for urgent action to combat the worldwide surge in domestic violence. I urge all governments to put women's safety first as they respond to the pandemic. Lockdown and intimate terrorism. As cities and towns across China locked down, a 26-year-old woman named Lei Li found herself entangled in more and more arguments with her husband, with whom she now had to spend every hour in their home in Anhui province in eastern China. I'm not going to read this, but this is my point. During the epidemic, we were unable to go outside, and our conflict just grew bigger and bigger, and were more frequent and more frequent. She said everything was exposed. So that's the thing. If you have a happy family life, this is a great opportunity to spend more time together. If you have a terrible family life, that time spent together is spiraling out of control. That's what this thing does. It's in time of any crisis, people are exposed for who they are, for how terrible and monstrous they are, or for how nice they are. In times of crisis and trauma, people are exposed. Just going to go down to the conclusion of the argument. Its lockdown began in early March. Soon after that, domestic violence reports began to rise. This is in Italy. But there was nowhere for newly desperate women to go. Shelters could not take them because the risk of infection was too great. So the government said local authorities could requisition hotel rooms to serve as makeshift shelters where victims could quarantine safely. These are some of the actions. Spain announced its lockdown on March 14th. France's began 3 days later. About 2 weeks later, with abuse reports soaring, officials there announced that they too plan to turn vacant hotel rooms into shelters, among other emergency efforts. Eventually, the lockdowns will end, but as the confinement drags on, the danger seems likely to intensify. Studies show that abusers are more likely to murder their partners and others in the wake of personal crisis, including lost jobs or major financial setbacks. With COVID-19 ravaging the economy, such crises are set to become much more frequent. Alright, watch out for those around you guys. People who are terrible pieces of shit are going to become more terrible pieces of shit. So that's what that article is describing, the domestic violence crisis that is growing. Alright, and here we're going to take a look at now this drug remdesivir that shows promise. COVID-19 patients who are getting an experimental drug called remdesivir have been recovering quickly, with most going home in days, Stat News reported Thursday after obtained a video of a conversation about the trial. The patients taking part in the clinical trial of the drug have all had severe respiratory symptoms and fever, but were able to leave the hospital after less than a week of treatment. The best news is that most of our patients have already been discharged, which is great. We've only had 2 patients perish, and an infection. Okay, and I'm going to go down here to the conclusion, because this was interesting about statistical power. The totality of the data needed to be analyzed in order to draw any conclusions from the trial. Anecdotal reports, while encouraging, do not provide the statistical power necessary to determine the safety and efficacy profile of remdesivir as a treatment for COVID-19, Gilead says. So here, the thing is statistical power. What that means is more testing and years of data that support that. So we're never going to get a treatment that has statistical power, because statistical power requires redundancy and time. What we want is anecdotal reports, and to just use those, right? And so in medicine, they're not used to that. They always want statistical power. That's just not possible right now. What we need is speed and efficiency. All right, guys. Those are the headlines I brought here for you in my pirate hat. Hope you guys have a great day. Go out there and do what you need to do, or stay home. Live the pirate life if you can. Yeah, thanks for joining me. Keep your hat on your head.